Erectile dysfunction is a common problem among men, especially over the age of 40, and like premature ejaculation, can be a hidden problem. But there has been a change in the perception of erectile dysfunction, with some of the prescribed medication now freely available over the counter, and this is ideal for men who are too embarrassed to see the doctor. I mean, the plus side is the easy accessibility of this medication over the counter, but the downside is the potential misuse of these drugs, especially in young men or even teenagers who do not actually have erectile dysfunction, but see these drugs more as a performance enhancer recreational drug. Also beware of counterfeit and rip-off black market versions which advertised as, satisfy your partner for longer, have longer and stronger erections. All fair enough, but a lot of these drugs have not been tested and they don't actually address the root cause of this problem. I mean, we live in a world where the pressure is on to look our best, to do our best, and to be our best in all facets of life, and how much more in the bedroom, where men feel that their manhood and masculinity is being judged, sadly, by their bedroom performances. Erectile dysfunction is much deeper than just popping the blue pill, and I'll explain why. You can also check out my video on choosing the best treatments for erectile dysfunction. So let's talk about treatment. I mean, in terms of treatment, the first thing you want to do is try and control any risk factors if they're present. So we'd advise stop smoking if you're smoking, reduce your alcohol intake if you're taking more than 40 units a week. That's going to cause you possible erection problems in the future. So we'll talk about managing your risk of diabetes, managing your cholesterol, blood pressure, as well as trying to lose weight. If you have low testosterone, then as I said, you might need testosterone replacement therapy, otherwise known as TRT. However, do not take TRT if you do not have low testosterone, as this would not treat your erectile dysfunction, though it might boost your sex drive. I mean, TRT is good because it also reduces belly fat and it puts you at a lower risk of diabetes. Conversely, taking erectile dysfunction drugs might not work if you have low testosterone, so it is important to treat any underlying cause first. TRT does have side effects such as acne, can increase your breast size, and can also reduce the size of your testicles. But even with treating your conditions and adopting lifestyle changes, you might still need to take erectile dysfunction treatment. So let's talk about them. We have what we call phosphodiesterase inhibitors or PDE5 inhibitors. The popular ones are Viagra, as we all know. Then you have Cialis, Levitra, and Speedra. These are the first line of treatment for erectile dysfunction, and they block the PDE5 enzyme, which helps to increase the blood flow to the penis to cause an erection. I mean, depending on the drug, they usually take in 15 to 60 minutes before intercourse. And they obviously would not work by themselves, so you need a bit of There are pros and cons to each drug, and what you decide to choose depends on several factors such as the frequency of intercourse, if you're taking any other medication, and your previous experience of the drug. For example, if you are the type that has intercourse every day or 3 times a week, then you might want to go for a low dose Cialis of 2.5 or 5 milligrams. If you have intercourse maybe once a week or once a month, then short-acting Viagra or 20 milligrams of tadalafil might be your option. The effects of Viagra can last up to 6 hours, while tadalafil, also known as Cialis, can last up to 36 hours. There are side effects common to each drug, as well as side effects specific to each drug, so you should read the leaflet before taking the drug. So for example, Viagra is known to cause visual symptoms such as blurred vision, blue-colored vision, rash, dizziness, which you might not get with other drugs. But commonly, phosphodiesterase inhibitors can cause headaches, facial flushing, blocked nose, and dizziness symptoms. Also, you might be on certain medications that stops you from taking these drugs. For example, if you're taking nitrate for a heart problem, then taking a medication like Viagra alongside a nitrate might cause you to have low blood pressure, because nitrates work similar to Viagra in dilating the blood vessels of your organs. Also, if you've had a recent stroke, you've got unstable angina, you've got very high blood pressure or very low blood pressure, then you should not be taking PDE5 inhibitors. I mean, whichever drug you take, whatever dose you start with, you can always increase the dose if you feel that you're not getting the effects, or if you feel that the effects are just too good, you can actually lower the dose. Also bear in mind that it can take up to 8 doses to the maximum dose to get the maximum effect, so even if you tried the drug just once and it did not work, do not think, oh no, this didn't work for me. However, if you've tried several PDE5 inhibitors and they've not worked, for whatever reason, then there are other options such as injections, creams, vacuum pumps, and even surgery. And if you like this video, please feel free to subscribe to my channel.